Which replacement lens is right for me?
We really have some incredible technology in cataract surgery nowadays, and some of the new advancements have come in the types of lens replacements that we can use.
There are monofocal lenses that work for many people to provide them with good distance or up close vision.
A lot of patients have what's called astigmatism, which is just the shape of the eye is a little bit more like what we would say a football rather than a basketball. A good option is called a toric lens, which does correct that astigmatism. It's a special lens that we orient to this astigmatism of your particular eye. If you want it set for distance or up close, it will get you out of glasses for those different distances.
The newest technology is a multifocal lens. That gives great vision for distance and for close-up and in many times intermediate. So you can see to drive, you can see to play golf. You can also see your computer without having to wear glasses. The multifocal lenses have really changed the game a lot and have caused some people to go through cataract surgery sooner instead of later because they realize the benefits that it can provide.